Okay, hi everyone. We are looking at the heart valves here. Now, when you listen to the heart, normally we would hear this rhythmic lub-dub, lub-dub, lub-dub. So what is it that we are listening to? We're listening to the closure of the cusps of these valves. The lub is the sound that's the closure of the AV valves. What are the atrioventricular valves? Well, those are the bicuspids and the tricuspids. Remember, the other name for the bicuspid is called the mitral valves. The dup, lub dup, lub dup, lub dup, lub dup. The dup is the closure of the semilunars, which is the aortic semilunar and the pulmonary semilunar. Lub dup, lub dup. So on the right-hand side, we see the bicuspid valve closed, and we see the tricuspid valve closed. So that's going to give us the lub sound. Notice the semilunars are open. Then we have the pulmonary semilunar and the aortic semilunar, those close. That's the dup or the dub, lub dup, lub dup, lub dup. When the semilunars are closed, the AV valves open. Now, we're listening with a stethoscope. And for the students that had me for AMP1, you may remember when I taught osteology, this right here is the manubrium of the sternum, and then here's the sternum itself. Right between the manubrium and the sternum, there's a little bump right here. We can all palpate it or feel it on ourselves. If we feel this jugular notch right at the base of our throat, and then we go down about 1, 2, 3, maybe 4 finger breaths, taking 4 fingers sideways, you're going to get to this little bump that we feel on the sternum. That bump is always at the second rib. We call it the angle of Louis. It's also known as the sternal angle. It's the angle of Louis, or the sternal angle is this right here, and that bump is always at the second rib. When you count the second rib, just inferior to it is where the second intercostal space is. Then you have the third rib. Then you have the third intercostal space. Then you have the fourth rib. Then you have the fourth intercostal space. Then you have the fifth rib. Then you have the fifth intercostal space. Okay? The intercostal space is where the musculature is, the intercostal muscles, the muscles between the ribs. That's where the diaphragm or the bell of the stethoscope is going to go. It always goes in the hollow spaces. You don't want to put it over bone. Put it over bone, you're not going to hear anything. When you put it in the spaces, that's where you can hear the lub-dub, the closure of the valves. Now, knowing the location of the valves is important, but the stethoscope is never placed over the exact location of the valve. You're not going to hear it loudest there. You're going to hear it loudest exactly at the most perpendicular part. You're always going to hear the echo where the walls are, the corner of the room. The corner of the room is where you're going to hear it loudest. So we know where the valves are. We go exactly to the wall of the heart, just perpendicular to it. And that's where we can hear the pulmonary semilunar, the aortic semilunar, the bicuspid and tricuspid valve, the lub-dubs, the lub-dubs, the lub-dubs. So knowing osteology and knowing the anatomical location of the angle of Louis is important, because once you find that second rib, we can find the second intercostal space. On the right-hand side, that's where this closure of the aortic is heard best. At the second intercostal space on the left-hand side, that's where the pulmonary semilunars are heard best. So you have to use this as your starting point to count ribs and to count intercostal spaces. There was a great nursing book that I remember I used 20, 30 years, over 30 years ago. It's still around. It's by an author called Bates, And we used to study the Bates book to learn how to do the physical examination of where do you listen for heart sounds and where do you listen for the lung sounds. It was always in that book by Bates. Still an amazing book all these years later. So now with these, knowing the normal sounds, the lub dub, lub dub, once you know what normal is, anything outside of that, they consider that to be a murmur. Now, there's different murmurs. There's a stenosis, there's a prolapse, and regurgitation. Now, a stenosis is an incomplete opening of the heart valve. A prolapse is an inversion of the heart valve, but there's no backflow of blood, whereas a regurgitation, there's an inversion of the heart valve with backflow of blood. Okay, so when we look here, here's the mitral valve, and we can see the chordae tendineae attaching to the bicuspid or mitral valve, and this is healthy. This is the way it should close. But if the pressure is too intense as this pushes up and the chordae tendineae are damaged, or the heart muscle is damaged, or the mitochondria aren't getting enough, making enough ATP, these can become weak and you get this malfunctioning mitral valve, which can allow backflow of blood into the atrium. That's a regurgitation. That's pretty bad. So this is normal. This is a prolapse, right? Look at the difference. This is closing. Now this is closing but lifting up due to the increased pressure pushing that up. Now after this phase, it kind of leads to the regurg. The regurgitation is now that the pressure is so great, you get a little blood leaking back into the atrium. Okay, that's when they do some surgical procedures in repairing the valves.